Good evening, and thank you for coming to this session. So tonight, we are going to start with understanding the causes of diarrhea and the different type of diarrhea, and what remedies and what you can do to help yourself.
Okay, good evening, everyone. Tonight's topic is dealing with diarrhea. In diarrhea, because diarrhea is a very common problem for all of us. Now, diarrhea cover both acute and chronic diarrhea, and basically the causes of diarrhea are numerous, and I will try to cover as much as possible. And just remember a simple principle. There's no one size fits all solution for diarrhea, right? In fact, if you can diagnose your diarrhea and identify the cause of diarrhea itself, very often there is a specific remedy that can help you with the diarrhea itself. Okay, now let's look at the chronic diarrhea. So chronic diarrhea actually is very prevalent, but if you look at it itself, in the general population, it's about 4 to 5%. But chronic diarrhea is very prevalent for the old people. So nearly 40% of the patients of chronic diarrhea are above 60 years old, which means that this is the most common types of diarrhea for older people. And if you look at it itself, what are the causes? It can be broadly divided into about six categories. First, functional diarrhea. This functional diarrhea including irritable bowel syndrome, which account for about 9 to 23% in the population. And in fact, in the primary care, it actually account for 50 to 60%. So this is one of the most common cause of diarrhea is the functional diarrhea. We'll talk about this diarrhea shortly. Organic diarrhea caused by organic diarrhea, which is diseases itself. So this account for about 10 to 20%. Now, and diarrhea that caused by due to malabsorption itself, bacterial overgrowth, pathophysiological problem. This also account to 15 to 20% in the elderly. Then we have inflammatory caused diarrhea, like inflammatory bowel diseases and infectious diseases, like we just mentioned. So this account for about 30% of infection caused diarrhea. Especially, it's more than 30% in low-income group. So then we have other like food causing, food that cause the diarrhea. Food can be due to laxative medicines, lactose intolerance, endocrine problem. So this also account for 5 to 15%. So you can look at it itself, there's so many causes of diarrhea, and therefore we will try to cover the majority types of diarrhea as much as possible, because I can tell you that for old people, some of us probably have multiple types of diarrhea together as well. So it's very challenging for us to deal with diarrhea, because it doesn't go away if we don't know how to deal with it. But although it's not life-threatening, but it is actually it will cause a lot of what they call malnutrition problem. So let's look at the classification of diarrhea itself. Now, in broad sense, if you look at the diarrhea, you look at the classification, this type classification system is actually it's easy for the layman. You choose it is because it's easy for the layman to identify yourself, what type of diarrhea you're having. And we can actually broadly break into three types. One is watery. Watery types of diarrhea itself, you will know. Generally, it actually can be caused by 2 to 3 types of other watery function. We can actually divide the watery to osmotic, secretory, or functional itself. We'll discuss this separately later. Then another types of diarrhea you can differentiate is the fatty one. The fatty diarrhea usually is foul-smelling. Stool is bulky and greasy. So if you look at the diarrhea itself, the stool itself, you were able to differentiate whether the diarrhea is watery or fatty itself. And there's a third type of diarrhea, usually is inflammatory. In this case, actually, you will very find that you find bloods in it, you find mucus in it itself. So these are actually a more serious types of diarrhea itself. So you, first of all, you need to differentiate the general types of diarrhea. When you have a diarrhea, whether it's watery, whether it's fatty or inflammatory. But now, as you can see from here, diarrhea management is not one size fits all at all, because a lot of management solution depends on the mechanism that's dealing with it. Okay, now first the guideline for self-diagnosis. I think everyone know how to differentiate when you have diarrhea. So I just give you a just quick rundown. So you can see from here that the standard BRIS-2 chart is a reference for actually defining whether you are having a diarrhea or you are constipated. So you can see that when the stool shape is this form, 3 and 4, these are considered healthy. Now, when your stool is actually of this type and watery, more mushy stool, these are actually, you know, it's diarrhea. And of course, when it's constipated, you know what it looks like. So anyway, doesn't matter. Don't worry about secretory osmotic itself because it's going to be quite challenging for you from the watery side itself. Basically, we all know when we have diarrhea. Okay, now, this is an important chart, although this chart looks a bit complicated, but this chart will give you the reference as to the causes of the diarrhea. And I will attempt in putting here in this table actually is the types of typical characteristics of this type of diarrhea. So you can, based on this type of typical characteristics, you can diagnose and to some extent narrow down the causes of your diarrhea. So this table is a very important guide. It might look very complex, but it's important because that you will know, as you can see subsequently, right, all the solution depends on whether you can identify what is the cause. So therefore, what are the stool types? The stool type itself, as I say, there are 3 watery types of stool types itself. The first one, osmotic stool types, are actually the stool volume decreases during fasting itself. So this, when you have a stool volume decreases when you fast, that means you don't eat, and you have a watery types of diarrhea itself. The common causes of this type of diarrhea is lactose intolerance. Very common is lactose intolerance. It can be due to magnesium laxative, antacid that overeating, or sorbitol, which is too much of sugar, the artificial sweetener in digestion. Now, when you have watery diarrhea, that actually where the very large stool volume, a lot of water in there and persists despite fasting itself, then chances are it could be due to your E. coli or bacterial infection diarrhea, or can be due to a bile acid malabsorption diarrhea itself. Now, when you have a watery diarrhea, that's actually functional. That means that there's no symptoms of actually having the problem at night, and it's stress related. Often it's just stress related, have no other causes itself. Then this is most likely that is due to irritable bowel syndrome, or what we call the functional diarrhea. And this is actually the most common type of diarrhea most of the old people have experienced for us. So most of the time, I'll put it that way, most of the time, unless you are Asian, that when you have watery diarrhea, chances are that you either having a combination of lactose intolerance or you're having functional diarrhea. This is generally my experience in that itself. But when your stool volume is very large and persists despite your fasting, then you have to be careful. It could be a bacterial infection types of diarrhea itself. Now, fatty diarrhea is easier to distinguish because it's actually a result of malabsorption. So you can see from there that the fatty diarrhea are smelling stool, oily stool itself. Now, these are signs of actually fatty diarrhea. So in this case, actually, the diarrhea persists despite fasting, but you have deficiency of vitamin D, K, and B12 sign. So you can actually go and search on the internet what are the signs of deficiency of K12, but never mind. But generally, these types of diarrhea, the causes are bacterial overgrowth, short bowel, and celiac diseases itself. Very often, it's actually the dysbiosis, which means that your gut bacteria imbalance, which is actually the SIBO, small intestine bacterial overgrowth. This is the most common type of cause of fatty diarrhea. Then, of course, you have diarrhea, have present of blood, pools in the stool, and you have fever and urgency, all this itself. Generally, these are actually disease caused, and in fact, you should not deal with it yourself. You should actually go for medical treatment. So basically, we should concentrate on watery diarrhea and fatty diarrhea itself, and the common cause are there. Let's talk about the most common chronic diarrhea, which is a functional diarrhea. What is a functional diarrhea? Functional diarrhea and also what we call irritable bowel syndrome, which we are familiar with itself, are the two major bowel disorder characterized by diarrhea. And this is due to what? The mechanism of this problem is actually due to the problem connection between the brain and the digestive system. So that means there is a communication problem in there, and therefore resulting that your diarrhea itself. So because this is actually, that's why some of the trigger are actually can be the stress can be a trigger. What are the distinguished symptoms of these types of diarrhea? First of all, abdominal pain relief after defecation, alternating diarrhea and constipation. So you might have diarrhea, you also can have constipation. This is because of the brain triggering your bowel movement in there. So bloating and excessive gas, less common, and there is no significant weight loss or fever. Very important. This is a very distinctive sign. That means when you have this symptom and you do not have significant weight loss or fever. But if you have weight loss and fever, that's another issue altogether. So the functional diarrhea itself, right, the prevalence are very common. You can see from there that IBS affects about 10 to 15% of the population, and IBS is more common women. This is more common woman problem. So what are the risk factors? So first of all, as I mentioned, because it's the brain-gut disconnection. So psychologically, the stress, mental problem are one of the trigger. And you have a history of GI infection also can be a risk factor. And you have an altered gut microbiome, which means an imbalance in the gut bacteria, frequently observed in IBS syndrome, which means that if you have medication or you sometimes you have a wrong food in there, it can also cause a bacterial overgrowth. This can cause IBS, the symptom of IBS. Dietary food and food intolerance. So basically, if you eat food that's rich in a lot of sugary food, in fats and caffeine and alcohol also are common trigger for that. And you also, if you have a case of normal gut motility itself, right, in the intestine due to surgery or due to actually some medical condition, it also can lead to this itself. And the hormonal changes like menopause, pregnancy, or hormonal therapy may affect IBS itself. So these are the major factors. You can see from here that the functional diarrhea, the most common types of diarrhea we have is the risk factors are so many. So in fact, no wonder that it's actually very common for most of us. And in fact, this is very common for the older women. So what are the strategies for this type of diarrhea? So I'm going to make it very easy for everybody. First of all, the diarrhea type is watery. So therefore, what are the dietary strategies when you deal with this type of diet? First of all, a low food map diet, reducing fermentable all the saccharides food. Right, I'll show you the detail of what are the food map diet types itself, and avoid the trigger. Limit the caffeine, alcohol, artificial sweetener. Now, for nutritional support itself, first of all, for IBS itself, this type of diarrhea, soluble fiber. So Atomis selenium husk can be a very good supplementation. Probiotics, remember, and herbal adjuvant, you can use curcumin and berberine itself. This is not available in Atomis portfolio. But then I think the selenium husk and probiotics are the right nutritional support itself. Now, important IBS is actually nerve trigger, brain and gut dysfunction. And therefore, actually, you need to manage your stress and anxiety. Make sure you have enough sleep and have relaxation routines. And of course, for those who suffer from risk of having thyroid diseases itself, you need to actually review for thyroid or medical related causes itself. Okay, now, and it's important for me to show you this because subsequently, a lot of dietary solution itself might refer to low food map diet. Now, low food map diet means what? Basically, if you look at it itself, there are food, vegetable that is considered low food map, which means less fermentation, and that will cause less gassy. So what are the ones? Actually, potato, eggplant, celery, green beans, pumpkin, carrot. These are low food map. What are the ones that you should avoid? Garlic, green peas, mushroom, onion, cauliflower, asparagus. So you can differentiate. So I'm not going to go through it again, but you can actually later on get a download of the PDF file, and then you can do your own reference itself. So even the fruits itself, kiwi fruit, mandarin, orange, basically the citrus-based food are suitable for low food map. But the sugary food, the fructose-rich food are not suitable. They are considered high food map food. And the dairy side, actually all the non-cow's milk, non-cow's milk itself are suitable. Lactose-free milk or cheese or almond milk itself or soya milk are good. Protein, basically eggs, tofu, plain cooked meats, and poultry, seafood itself. Breads and cereals, oatmeal, rice, sourdough, all that are okay, right? Gluten-free products. Sugary, sugar, sweetener, dark chocolate are okay. Maple syrup, okay. Table sugar. And nuts and seeds, basically peanuts, pumpkin seeds, and all that. And avoid cashew nuts, pistachio. So these are basically a reference for you. And when you talk about low food map diet itself, basically you have a list of food that you should avoid. A list of food that you actually need can be considered. Now, for IBS itself, what are the complementary and alternative therapy? Here I list 4 items. Right? You can take it as a very good reference because they are very good, what they call backup study on that. There's a lot of results showing that they are very useful. Probiotic, vitamin D, curcumin, and berberine. So all these 4 products are useful supplements when you are suffering from IBS. Now, for chronic diarrhea, there is a big segment of chronic diarrhea due to food intolerance. So we put food intolerance diet. If you look at it itself, food intolerance affects 15 to 20% population globally. In fact, a lot of us actually, the diarrhea is caused by our food problem. So main cause of food intolerance can be also subdivided in 3 subgroups. One, there's food intolerance that's caused by carbohydrate intolerance. So this is our common, most familiar lactose intolerance and fructose intolerance. We'll talk about this shortly. Then we have the protein intolerance. Protein intolerance actually are the gluten intolerance and cow's milk protein. So then we have a food chemical intolerance. Basically, this is saccharide sensitivity and histamine intolerance. So this is the lesser concern because the prevalent rates are lower. So I will not talk about this in this session itself. So the main one we'll talk about on the food intolerance cause diarrhea are the carbohydrate intolerance, which form the bulk majority of our food intolerance diarrhea problem, and also the protein intolerance. Okay, now let's look at the lactose intolerance. So this is a form of carbohydrates. So you can see from here that the deficiency of our lactase enzyme is actually the cause. So therefore, it's due to our enzyme in our body. It's deficient. And as this enzyme gets less and less in our body, then when we eat food that contains lactose, the carbohydrates itself, the body will actually reject it and you have diarrhea. Right? What are the symptoms? Diarrhea occurs shortly after consuming dairy. Very typical symptom. So the moment you drink a milk and you have a diarrhea, this is one of the telltale signs that you're having that itself. And some of them will have severe bloating, cramping, and excessive gas itself. Symptom resolved when avoiding lactose-containing food. Now, one of the very significant one is the diarrhea occurs shortly after consuming the dairy product. Now, remember, these symptoms itself do not coincide with very loss of blood in stool. If you have this, it's a totally different issue. So there's a very interesting study I picked up, Malaysia study report. So Malaysia basically have a very high prevalent rates of actually lactose intolerance, and they try to see whether there's any difference between ethnic groups. So you can see from here that basically there are not much of a big difference, although the Malay actually fare better, lactose deficiency lower lactose deficiency compared with Chinese and Indian. But Chinese and Indian are having a close to 90%, means that most of the Asian, except for the Malay side, in fact, I will put it even including the Malay itself, 80%, more than 80% of the Asian population are suffering from some form of lactose deficiency. So the degree of lactose deficiency varies by people. So if you have a high lactose deficiency, then you will have lactose intolerance diarrhea. But some might not. Some might be able to tolerate a bit. Now, what is the dietary strategy for people who suffer from lactose intolerance? First, of course, I think that avoid all the dairy-free or low dairy-free food, the dairy food. Right? So basically, you have a dairy-free or low lactose food. So this is the first solution. Nothing to say. Because your lack of that enzyme, so avoid the food that containing lactose itself. Alternative is use the utilized plant-based milk, soybean milk, oat milk, and so on. What are the nutritional support? So this is where the supplementation play a more important role. First of all, you can actually supplement with a lactase enzyme supplement. So Atomy have a enzyme supplementation that contain lactase. So you can take that as a supplementation to increase your lactose tolerance. So probiotic, certain strain of probiotics which can help to improve the lactose digestion, and also calcium and vitamin D also is help to prevent deficiency with diarrhea. If you don't take dietary product, right, you need to supplement with calcium and vitamin D. And remember that. So this is not really take care of the diarrhea, but it's more what they call complementing the lack of your diet, the diet deficiency in calcium and vitamin D. Now, important, when you have this itself, also need to make sure that you do drink because you're having a diarrhea. So remember, as I say, the rules is very important. So when you take care of the diarrhea, make sure that you avoid the high sugary sport drink. Excessive sugar also can cause this type of diarrhea. So when you are drinking more drink, for instance, having a lactose intolerant diarrhea, please avoid sugary drink as well. Okay, fructose intolerance and malabsorption. Now, this is actually due to the sugar. Sugar. That one is not sugar. That is due to milk, carbohydrate in the milk. So in this case, the fructose intolerance cell, what are the symptoms? The very distinguished symptom of this is bloating, gas. Although the diarrhea is still watery, abdominal pain, but the distinguished symptom is bloating and gas itself. And dose dependent. What it means that the more fructose you take in, the more severe the symptom, the less severe. So it's actually depending on the dose you take. So this is very important. And there's a very interesting study by Singapore. Singapore's Ministry of Health said the Singaporean consume about 12 teaspoons. Then it's approximately 60 grams of sugar daily. It's actually quite high, but Singapore is, I think, is one of the high sugar intake country. So if you look at it itself, we over half of them from sugar sweetening beverages from the beverage itself. There is a study suggests that up to 50% of the general population cannot completely absorb a 25 gram pure fructose load. That means that if you look at it itself, 50% of the population cannot absorb a 25 gram pure fructose load. And 60 grams of sugar itself at least will have more than 25 grams of pure fructose sugar in there. So therefore, it means that the estimated prevalence rate of fructose intolerance in Singapore, for instance, for the adult itself, is actually 30 to 50% of adult. So it is very common. It all depends on where, but I think this study showed that in Singapore, in fact, more than 50%, about 50% of adults having this problem. So now, what is the solution for fructose intolerance itself? This is a very simplified table for everyone already. Your diarrhea type is watery. Now, the strategy is low FODMAP or low fructose diet. Now, as you say, fructose diet means that all the food, sugary food, especially the apples, pears, and watermelon. These are sweet fruits and which have a very high fructose content itself. Honey, syrup, high fructose corn syrup, fruit juice, and dry fruits. These are all very high fructose food should be avoided itself. So you should adopt a low FODMAP diet and glucose co-indigestion, which means that if you consume glucose, the fructose, you probably can improve your absorption. Like table sugar may be better tolerated than pure fructose itself. Now, choose lower fructose fruit like banana, blueberries, strawberries, and so on. Now, the nutritional support side, again, so first of all, probiotic. You, of course, as I mentioned, the low FODMAP plan, you have probiotic and general micronutrient support, which means that basically for this case, general multivitamin will be recommended generally for the fructose intolerance diarrhea. Now, the third types of diarrhea that's caused by protein is called gluten intolerance. Gluten intolerance actually is a disease, and you can subdivide it into two subclasses. One actually is a non-celiac gluten sensitivity. Basically, it's actually the body immune response to the gluten or wheat component without autoimmune or allergic mechanism. But another one is actually a celiac disease, which basically is the autoimmune disorder response to gluten itself. Now, for most of us, for the general public, the non-celiac gluten sensitivity is more prevalent. So, and general symptom for gluten intolerance is that, first of all, bloating, abdominal pain, diarrhea, very common in a lot of cases itself. Extra intestinal symptoms are like fatigue, headache, brain fog, and joint pain. Now, these are something that commonly occur for people who suffer from gluten intolerance, common for other types of diarrhea. So this is one of the ways for you to distinguish yourself. Now, occur between hours to days of gluten indigestion. It's not an easy diarrhea to actually diagnose itself because this is actually a disease condition itself. And very often, I think that you will need probably medical attention to actually know how to actually diagnose and identify this problem. Now, if you are suffering from celiac diseases itself, one of the things that you can distinguish yourself is that your diarrhea is always a fatty diarrhea. So that is the only distinguished symptoms that you can have that that diarrhea is due to celiac disease or celiac-related disease or gluten intolerance problem. So in this case, the dietary strategy is very straightforward. Very strict gluten-free diet. So you have to completely avoid wheat, barley, and rye. Then the nutritional support side will focus on the anti-inflammation food. And of course, any anti-inflammatory supplement is also helpful for this case. So the correcting the deficiency of the malabsorption, you have to supplement yourself with actually the oil-soluble vitamin, vitamin D. And then you also have to supplement with irons, calcium, zinc, magnesium, folate, and B12. So a multivitamin very often is also recommended. Another type of diarrhea that's caused by a small intestinal bacterial overgrowth. We short call it SIBO. This is actually very common when your bacteria in your intestine is actually over-colonized by fat bacteria. So it's very prevalent in the IBS patient, can be up to 80% in some IBS patient itself. So this what's the problem? The problem is that the slow passage of the food going through your intestine, resulting in the breeding ground, causing the carbohydrate, the food to fermentation, so the bile salt deconjugation and mucosa damage itself. So, and then resulting in malabsorption and diarrhea. So this is the mechanism that causing it itself. So basically, there's a fermentation of the food. Bile salt deconjugation means the bile salt reabsorption is affected itself, resulting in malabsorption and because of the membrane damage. Okay, now what are the presentation of SIBO? The clinical presentation for SIBO actually can be, the distinguished one basically is a chronic diarrhea. It's a watery diarrhea again, but severe bloating and excessive gas is one of the very distinguished symptoms. It means in this type of diarrhea, very often it comes with bloating and excessive gas. This is a very distinctive symptom itself. Symptom will worse after eating the food map, which means the fermented food. If you eat fermented food, the symptom will go out. Get worse itself. Now, loss of appetite, nausea, abdominal pain, cramping, fatigue due to nutrient deficiency are additional symptoms of some of the people. Now, the problem with this is that it can cause complication. If you don't treat it itself, you can have malabsorption syndrome, which is actually in the long term, it causes a lot of other complications. You have vitamin deficiency, especially the oil-soluble or vitamin of A, D, E, K. So therefore, it's very important that you need to supplement with the oil-soluble vitamin. And you can cause weight loss, it can cause anemia due to malabsorption. Okay, what are the risk factors for these types of diarrhea, which is actually caused by bacterial imbalance or overgrowth in your intestine? Aging is a problem. And therefore, as you age, our enzyme go down, our gastric acid go down, our ability to actually digestion go down or motility slow down, right, in gastric, in our intestine. And therefore, this is one of the major risk factors. So it means that a lot of us, when you're getting old, you have a higher risk of having indigestion, diarrhea due to the bacterial overgrowth. Another one is actually the medication. There's a lot of medication that can cause this because it actually disrupt the balance of your intestine bacteria. And like proton pump inhibitors, antibiotics, formins, and painkiller. So these are very common. Metformin is a diabetic. This is actually the gastric reflux. PPI is a gastric reflux medication. So this is a very common medication we take, and then in fact we are very often sometimes concerned the metformin and PPI long term. You have to take it for long term, and therefore you will result in your bacterial imbalance in there and resulting in having diarrhea. So you might have what they call the medicated trigger side effect of diarrhea due to medication. Now, other thing is that when you have surgery, you have gastric bypass, or you have other issue in the medical body, then you also can cause this problem. Right? Usually, this is due to a shortening of the intestine, due to surgery that cut short the intestine. So the medical conditions are diabetic. Diabetic patient, about 20% of them will have this problem. Hypothyroidism, 20 to 30%, which means that these are the medical conditions that can also resulting in your what they call the diarrhea due to the bacterial imbalance in the intestine. Now, the SIBO treatment, the table for SIBO treatment. First of all, the SIBO, the diarrhea types is watery. The dietary strategy is low food map. Now, low food map alone is not enough. Very important actually is that in this case, you need to time your meal and portion control, because the issue is that your intestine is having a very slow motion to your passageway. So you do not want to eat too much, so that too much of food stuck in there and then causing fermentation. Because there's a lot of bacteria there that you can cause fermentation. So meal timing and portion control become a centerpiece in your dietary strategy for SIBO. Then on the nutritional support side, as I say, fat-soluble vitamins are important because your malabsorption resulting in all the fat-soluble vitamin loss deficiency. So you need to supplement with fat-soluble vitamin, B12 as well. And then also you actually see whether you can take zinc, L-glutamate, and probiotic after actually any of the treatment itself. Okay, now another very common one is actually the bile acid malabsorption. Actually, this bile acid absorption is part of the trigger caused by the bacterial overgrowth that we said earlier. So what is the mechanism of this is that our body normally secrete the bile acid. The bile acid acts as a very important component in our digestion system, try to break down our fat-soluble nutrients itself. Now, the bile acid is not reabsorbed in the end of the small intestine completely. Normally, 95% of this bile acid is actually absorbed after it's excreted from your liver. Actually, at the end of this small intestine, 95% is reabsorbed. Only 5% go into your large intestine. Now, in this case, if your bile acid is not fully absorbed and if a lot of the bile acid actually is run into the large intestine, you result in actually trigger water secretion. And because the bile acid is an acid, so therefore the large intestine will secrete water into there to flush out itself. So resulting in watery secretory diarrhea itself. So this is actually very well connected to actually the bacterial overgrowth problem. Now you look at it itself, the symptom basically chronic watery diarrhea, very urgent, difficult to hold. And this is a typical symptom for these types of diarrhea. Increased bowel frequency, especially post-meal. Now the problem is that this always have a lot of overlap with the bacterial overgrowth symptoms of diarrhea. But very common for old people is that when you are having urgent, difficult to hold watery diarrhea very often, and then whenever post-meal, you will always have a higher frequency of going to the toilet. This is one of the symptoms of the BUM. Now, the condition that's associated with BUM, you look at it itself, you can see that the blue one representing all the surgical condition. The green one is the one that actually have diseases that we just mentioned, like IBS, functional bowel diseases. These two are the common other diseases, digestive diseases, diarrhea diseases that we just mentioned, that is actually having a medical condition that's together associated with BAM as well. So you can see this bile acid absorption, reabsorption problem is very common and in fact widespread, concurrently occurring in many types of disease conditions, including our SIBO, the bacterial overgrowth condition itself. What to do with this type of malabsorption diarrhea? First of all, concentrate on the diet itself. The primary strategy is reduce your fat intake of the diet, because the bile salt is excessive itself, and then it's not reabsorbed. So therefore, what you want to do is must restrict the fat intake. This is one of a very effective strategy itself. So if you have this condition, you can try to cut down on your fatty food intake, increase your soluble fiber. So Byzinium, husk, oats, bananas, cooked vegetables are good source of soluble fiber itself. And the nutritional support side, as I say, fat soluble vitamin A, D, E, K is very important because it's a case whereby you lose all your nutrients, fat soluble nutrients, and also vitamin B12. All right, now let's do a summary of these two. Because they have overlap. Bacterial overgrowth itself, the dietary focus is low FODMAP. But if you are suffering from bile acid malabsorption, the dietary focus actually is low fat. So there is a very different strategy altogether. Remember, so if you find that yourself is actually due to the bacterial overgrowth diarrhea, then you actually choose to have low fermentation food. But if you're due to the bile acid reabsorption problem, then you should cut down your fat diet. Okay, now the problem is that both conditions can coexist. So I put it that way, the SIBO and BAM are common underdiagnosed cause of chronic diarrhea. Very common, very common. And this is where the complication of how to deal with diarrhea. That's why I take time to explain it, because this is a complication itself. So you want to distinguish them is that if you are sensitive to the FODMAP, that means a high fermented food itself, then your cause of diarrhea is due to the bacteria, SIBO. But if you are sensitive to the fatty food, and you cause diarrhea, then your cause is due to the BAM. So therefore, this is the way for you to distinguish the type of diarrhea, depending on the food you take, which one you are more sensitive to itself, right? But very often these two coexist, as I say, right? So general practice for both itself, right? So first of all, prioritize low-fat diet. Try to cut down on your fat, if you can, and at the same time avoid highly fermented food. So these two have to go concurrently if you have both conditions exist, which makes sense. Now, general practice for both: keep detailed food and symptom diary, stay well hydrated between meals, avoid alcohol, caffeine, manage stress, and consider small amount of ginger or peppermint tea, which is helpful for you. Probiotic actually is one of the most effective therapeutic supplement for chronic diarrhea. So I would do with all the detailed study, the reports you have. You can see from here the probiotic is effective in treatment of a lot of types of diarrhea, including lactose intolerance, Traveler's diarrhea, antibiotic diarrhea, and chemo-induced diarrhea, so on and so on. So therefore, it's always a standard supplementation for chronic diarrhea. Okay, now, when chronic diarrhea needs medical attention, patients with these symptoms require medical attention when you are having symptoms that wake the patient from sleep. You have unexplained weight loss, you have visible blood in stools, or you have a family history of celiac disease, IBD, or colorectal cancer. Now, if you're having these symptoms, this should be an alarm feature for people suffering from chronic diarrhea. So do not keep it to yourself. Go for medical advice. Okay. Now, the self-management in chronic diarrhea as a general core principle, hydration is priority in all types. Dietary adjustment depends on cost, as we all will understand now that depending on your cost, you have to adjust your diet according to. So you need to understand and identify your cost. Reintroduce normal diet gradually. Seek professional help if you persist more than 2 weeks or with red flags. These are general self-care principles for people who suffer from chronic diarrhea. Okay, so this is the end of my session. I pass back the time to Pauline.